I will be talking today about more specifically about what's the benefits and utility of doing neuropsychological testing, and like the clinical utility of it, and how can it kind of also contribute in terms of like a clinical research. So first, I'm going to kind of go over what is this neuropsychological evaluation, and let me actually see, why is it running? All right. So there are many different types of assessments. There's psychological assessments, educational assessments, speech, occupational, physical, and there's a neuropsychological assessments. And clinical neuropsychological evaluations, it's specifically in a field of clinical psychology that's really dedicated towards understanding relationships between the brain and behavior, and how it can be used in terms of diagnosing any brain disorders, detecting brain dysfunction, and also in terms of designing more personalized treatments. And so if anyone has ever had their child do a neuropsychological evaluations before, some of the tests that's used may be similar to tests that's used in other aspects of testing. So speech evaluations, occupation evaluations, or psychological evaluations. But the differentiation is really on how we interpret the data and how we kind of make sense of it in the context of medical conditions. There are many different types of neuropsychological assessments. There's screening consultations, which is when you meet a neuropsychologist briefly to kind of go over a referral question, and they might provide you some more immediate recommendations about treatments. There's more focused assessments if you have very specific questions, for example, like ruling out autism. There are forensic evaluations, which are usually done in more legal settings, not usually typically in a hospital or academic medical centers, but it's like to look at, for example, sequelae of like head injuries. And diagnostic assessments, which is basically to kind of look at your kind of cognitive strengths and weaknesses, and make sense of whether or not that it would meet a clinical diagnosis for neurodevelopmental disorders such as intellectual disability, learning disabilities, ADHD, etc. Progress evaluations are looking at your kind of response to treatment. So response to academic interventions, response to speech evaluation or speech therapies, behavioral therapies, etc. And there's also rehabilitation and treatments. So this might be someone who goes either inpatient or more specialized outpatient treatments, of where you get rehabilitative services like more severe or more significant speech occupational therapies. And neuropsychological evaluations can be helpful in terms of thinking, helping decide what are appropriate goals, and then also monitoring progress. And then last is that we also often don't think about it in the clinical settings, but really also neuropsychological evaluations can guide research, especially in rare diseases. It's kind of like the initial step on how we figure out more broadly a kind of general cognitive profile, and so it can kind of guide more subsequent research questions. Again, what I mentioned earlier, while neuropsychologists use test measures that overlap with different other assessments, this type of evaluations provide more specific inferences about brain functioning and on cognition and behaviors. So really more about inferring based on your test performance, what if there are specific kind of brain networks that are being affected. There's also that it's an assessment that can also sometimes detect dysfunction in the brain even before structural anomalies. So for example, someone who have hydrocephalus or susceptible to hydrocephalus may sometimes see subtle changes in processing speed and some of these kind of like working memory or cognitive proficiency areas before you might necessarily see more structural changes. And then it also allows you to kind of look at your performance compared to others your age, but also individualized. So for example, I describe it kind of like a growth chart. It allows you to kind of map your own progress over time. And so we have a better idea on prognostically what outlook, and also thinking about more individualized kind of interventions. Different areas that we assess in neuropsychological as evaluations include kind of intellectual functioning, language, visual or spatial processing, motor skills, attention, executive functioning, which are kind of like more goal-oriented behaviors like inhibition, set shifting or mental flexibility, learning and memory. Sometimes we look at social cognition, like how you process social information. We screen for behavioral functioning, so again, and emotion functioning, so things like anxiety, mood, and then adaptive functioning, so your life skills. So how are you able to kind of do things independently and navigate navigate the world around you. I put a little asterisk around academic skills because if you do testing in a academic medical center, you might not necessarily get academic testing because the focus is often on more broad cognitive functioning. But sometimes we might do screening for academic progress to see if there are areas that we might want you to kind of do more thorough evaluations through school. Some of the common types of questions we get in neuropsychological evaluations include questions of that monitoring your child if they have a developmental delay and kind of getting more diagnostic clarification if they would meet a specific kind of diagnosis. So thinking about, for example, intellectual disability, language disorder, or anything like that. If there's a decline in cognitive functioning after acquired injury, so for example, if you notice a change in functioning after head injury, loss of oxygen, so like for example, drowning, viral infections, a regression, meaning loss of skills, or any kind of changes in cognitive or thinking abilities with emergence of psychiatric kind of concerns. So like increased anxiety, mood, erratic behaviors, etc. And then very commonly ADHD or learning disability rule-outs, and then autism kind of concerns. Oftentimes it helps kind of increase or open access to services. So for example, some states you might have to have autism diagnosis in order to get ABA, even though most neuropsychologists know that ABA therapy can be helpful, incredibly helpful for others with neurodevelopmental disorders outside of autism as well. It also can be used to monitor your cognitive functions or thinking abilities in the context of new medical diagnoses and treatments, like if you have onset of seizures, and sometimes seizure medications may also cause changes in thinking or like memory, learning. And so again, we may also do testing in response to your types of treatments that's being given. Testing can also be helpful in monitoring progress to things like academic interventions, like school-based interventions, and also behavioral interventions. And last is oftentimes we help with transition planning. So individuals with developmental disabilities in older adolescents who are then becoming an adult, thinking about vocationally, what are types of jobs they might be able to do, independence, like wanting to screen to make sure that they're able to comprehend more complex decision-making, etc. And then if not, helping with families in thinking about services that they may be accessible or that they can access. Often we monitor kind of what developmental progress looks like, and this differs from each person. When we think about typical development, it's this kind of red line where you're kind of incrementally making progress over time. Oftentimes, individuals with neurodevelopmental disorders have other kind of trajectories, and so which means that you might have persistent delays, meaning that you're still making progress, but it's just not as steep. Or some individuals might, in different areas, might start to show stagnation. So for example, some developmental disorders or genetic conditions like Williams syndrome, you might see that their language abilities continue to kind of make more gains over time still, but that their visual spatial kind of reasoning, visual spatial processing at an earlier age start to kind of show some stagnant, and it becomes, you don't see as much progress or change over time. And that areas tend to be an area of relative weakness for them. And then for others, you might see a regression. So like some genetic syndromes, you might see that some regression or change, particularly in a context of medical conditions like seizures. And then, so thinking about then how can neuropsychological evaluations be helpful in clinical research? I'm going to kind of give a little example of somewhat recently known, sorry, I'm going to pause here. It's kind of moving by itself on my slides. I'm going to give it just an example of some of research we've been doing with neuropsychological evaluations that kind of guide subsequent research questions with one of the Mendelian disorders, Wiedemann-Steiner syndrome. Also done in collaboration with Dr. Harris and Dr. Farner. So generally, neuropsychological evaluations can help us understand neurodevelopment associated with syndrome. And it can be, I think, thought of for potential behavioral markers for or cognitive markers for clinical trials. So it's kind of really the first step, helping us understand a disease first. It gives us a general kind of characterization or general pattern of cognitive functioning that we know for a disease, which then can help us infer potential brain areas that might be impacted downstream from the epigenetic kind of dysfunction or dysregulation. And when we start to know the areas are being impacted and potential brain networks are being impacted, then we can start to kind of design more specific behavioral paradigms, more specific kind of thinking about looking for more specific biomarkers then that would be better targeted towards that. And so again, it kind of provides an initial step of figuring out what are areas that may be specifically impacted by a genetic syndrome, and then also then helps us guide subsequent questions to ask. So, for example, what we've been doing in our kind of cross clinics between neuropsychology and epigenetics over at Hopkins and as well as over at Kennedy Krieger with Dr. Harris. We've kind of been looking into one of the Mendelian groups, Wiedemann-Steiner syndrome, which is an MDEM that has a mutation in KMT2A, similar in terms of a family class of genes that's being impacted in Kabuki syndrome as well. And so it's typically associated with intellectual disability or global developmental delay. But when we think about that, a lot of these kind of Mendelian disorders, epigenetic machinery, even though we know it's associated with intellectual impairment, we really don't know the specific cognitive characteristics. For example, someone with intellectual disability can have much more severe language impairment. They may be nonverbal and still have that same diagnosis compared to someone else who have much more visual impairment, what we might see in Kabuki syndrome or visual spatial deficits. But they both are still characterized by intellectual disability despite having very drastically different kind of cognitive profiles. So this is actually what we saw with Wiedemann-Steiner syndrome as well. With neuropsych testing, we looked at 10 individuals who've done neuropsych testing clinically in our clinic, and with a molecular diagnosis or genetic confirmation of Wiedemann-Steiner syndrome. And when we looked at kind of the patterns overall, and green being that an area that's completely intact, red being an area that's impaired, and yellow being kind of in between, like below average. When we looked at out of the 10 individuals and kind of where they scored, we generally see the frequency of individuals scoring much higher in impaired range in visual spatial functions. So visual spatial perception, visual motor kind of functioning, and visual memory compared to verbal functions. So looking at the left side, the green. We also saw generally that these individuals tend to have a significant kind of more attention and executive functioning weaknesses, so much more poor in kind of attention regulation and short-term memory. And then also, interestingly, a very kind of drastic difference in terms of much more preserved sight word reading, but significant impairment in math, which is also associated with spatial processing. And again, this is Wiedemann-Steiner syndrome has a mutation in KMT2A. Again, this kind of gene class of family genes very similar to kind of Kabuki syndrome. And so, which we do know has kind of more of these kind of visual spatial processing deficits. So because of these kind of patterns, we then have the question of, well, if we know now that we see this kind of pattern in our kind of clinical patients, we start thinking about, well, what are some research designs that we asking more specifically using screening methods and using same measures across all patients or all participants to look at kind of more behavioral functions. And so because we saw the attention and executive functioning being particularly affected, raises question then, are there higher rates of ADHD or more attention deficits kind of behaviors in these individuals? And so we gave screening measures to about 24 families with children with Wiedemann-Steiner syndrome or young adults with Wiedemann-Steiner syndrome. And again, we do see this kind of much more elevated hyperactivity attention deficits. So that tends to be an area that's significantly affected. About 70% to 80% of patients with has problems in this area. And so we then have a question, well, what underlies these kind of behavioral dysregulation? Is it because of those executive functioning weaknesses? So executive functioning meaning more like inhibition difficulties, cognitive flexibility difficulties, and short-term working memory difficulties. And so then we also had families do some questionnaires on more of the executive functioning areas and kind of day-to-day executive functioning skills. And generally what we see is that those families are reporting much more kind of behavioral dysregulation, so much more difficulties in managing behaviors than actually cognitive regulation. So cognitive regulation being like working memory and mental flexibility, whereas behavior regulation is kind of like response inhibition, kind of impulsivity. And what we saw also was that the executive functioning deficits in this sample tends to be predictive of their kind of behavioral challenges in day-to-day life. So like more of the hyperactivity was because of or associated with this kind of executive dysfunctions, which tells us then in terms of behavioral interventions, we can start to think about whether or not executive functioning coaching, executive skills coaching might be particularly more helpful for the sample. And then we also saw, again, what I noted earlier, this kind of discrepancy between word reading or sight word reading and math skills. And so we had families complete screenings measures on what they observed with their children in terms of academic learning difficulties. And generally, we saw similar areas of what parents are reporting is that they're reporting overall more variable reading skills, but a very consistent deficit in math learning and very consistent deficit in spatial skills. And so again, this is very consistent with what we're seeing in also our cognitive data in our case series or the clinical patients that we're seeing in clinic. So like, just like, using that Mendelian disorder, Wiedemann-Steiner syndrome as a kind of sample of how we just more recently, just the past year actually, have been able to use neuropsychological evaluation and neuropsychological data to guide research. It shows us that broad neuropsychological testing can offer clues to guide subsequent studies and help us kind of refine hypotheses. It helps us kind of refine our aims and thinks of what next steps to kind of ask questions on. Earlier initiation of assessment services can also help your child obtain a baseline, so get a baseline kind of measure to monitor for any changes in cognition and brain functioning, especially if they're at risk for kind of things like seizures. It's really important to note that not all genetic disorders with a risk of intellectual disability present the same. So like what I noted earlier, some individuals' intellectual disability might have much more language impairment, others might have much more visual impairment or visual spatial deficits like Wiedemann-Steiner syndrome. And even those with the same syndrome, there's going to be significant variability in cognitive functioning. So, and we are not exactly sure why. Then that's why it's important to do that research, right? Is that even with the same genetic kind of mutation, we still see some differences, even though for the most part we see this pattern, there's still going to be a range of functioning among those with the same diagnosis. And so it's important to do testing because it also allows us to capture those differences and help provide more specialized care for each individual child. So again, neuropsychological testing allows more precision medicine, more personalized care, targeted treatments, and dosages of treatments unique to your child. Because again, like what Dr. Harris mentioned, we can only do so much therapies, right, in a day. So really kind of helping kind of prioritize what's most helpful for a child and then provide a more individualized school experience. And after disease phenotyping, future research might also include comparing more across cognitive phenotypes or across Mendelian disorders. So thinking about cross comparison across different types of Mendelian disorders with epigenetic machinery being disrupted. And so I just want to kind of acknowledge and thank, some of the research presented was from different patient foundations, including Cat6A Foundation, Wiedemann-Steiner Syndrome Foundation, the IDDRC over Kenny Krieger, and as well as lots of help from Dr. Harris, Dr. Farner, and Dr. Bjornson over at Hopkins and Kenny Krieger. If any questions you guys have for me,